Hi, my name is Dr. Raja Adnan Ahmed, and I'm a consultant psychiatrist working in UK. And I'm doing an interview series with the successful IMGs who are currently working in UK to invite them on this forum and so they can share their journey and their experiences and some advice from the next generation of IMGs. With me this afternoon is Dr. Khizer Iqbal, and he's an IMG who is currently working in rheumatology. And I thought it would be a good idea for Dr. Iqbal to share his story and uh, also his experience of how to actually secure the rheumatology training. Dr. Iqbal, thank you very much for joining me.
Thanks, Dr. Adnan. First of all, I am thankful to you for inviting me to today's talk. And I think you are doing true mentorship for IMGs. I have been watching your videos for almost a month, and today I thought that I should be a part of your platform. So if I can guide my IMGs who really want to join rheumatology as a specialty, I think that will be honor for me.
Can we start by asking you about your journey so far to UK?
Currently, Dr. Adnan, I'm working in Ireland, but I will join soon United Kingdom, North Lincolnshire for my specialist training in rheumatology. When I came to Ireland, basically I wanted that I should stay in Ireland for a month or two. I pass my PLAB and then I can go for IMT or CMT training. But unfortunately, when I came to Ireland after passing my internship, and then I spent 1 year as a specialist trainee under CPSP, then from internship, I wished that I should go abroad to get some international experience. So that was the idea behind coming to Ireland. So I thought that I should come to Ireland, stay for 3 to 4 months, and then I moved to UK for CMT and basic specialist training. But unfortunately, when I came here, my mother was diagnosed with cancer. So when I came here, I was totally like not focused during that phase. She was quite in and out in hospitals for her treatment. So first 2 years, I spent more focusing on her treatment and more family commitments. So in 2018, when she passed away, then I thought where I was standing, so I thought that I am standing nowhere because I missed the train, like I thought that now what could I do, and then join the specialist training again. So for that reason, I just compiled myself again, and I thought that, okay, and at that stage I was working in rheumatology as a rotating registrar. So I thought, okay, and rheumatology, I like the working because it's quite comfortable. So it's a bit holistic approach, and like with advent of different biologics, so prognostic and outcome of rheumatological disorder has been changed dramatically. So I think, and back home, there is a huge shortage of rheumatology specialty as well. I thought, okay, let's focus on rheumatology. So then one of my friend who got ST training in rheumatology, and I think he was a bit role model to me. So I thought that, okay, I should follow that track. So I sat down, I just brought out the page and wrote, what should I do? So I thought that next 2 years, I will pass my membership exam. I will commit it with rheumatology as much as I can. So I had that one thing in my mind is that that luck won't squeeze me into the specialty training, and for which I had to do hard work. So there is no other reason that I can go in specialty training without hard work or without passing exam. Since 2018, like when I came back from Pakistan, I thought, okay, listen, because you had done so much family commitment, now it's time to focus on your career. So at that stage, one of my Pakistani consultant, who is a rheumatologist in district hospital, I talked with him. I said, look, I want to pursue my career in rheumatology, and will you help me in acquiring some posts? Because he was very happy with me, and he was much happier with me to give me reference. So he talked with one of the consultant in tertiary care hospital, which is Dublin, in rheumatology department. So I got a job in the mid of 2018 in Dublin. So when I went there, I was very focused. I sat with my supervising consultant. I said, look, I have to go ahead. I want specialty training. Unfortunately, I could not apply in Ireland for a specialist registrar post. The reason is that because I haven't completed my BST. In Ireland, it's mandatory to do basic specialist training to acquire higher specialist training. So I thought like there are two options at that stage. Either I should go back to BST in Ireland and go for HST, but I thought that it's just a waste of time because I have ample experience as SHO, as medical registrar. So I thought that I should go ahead for specialist training in the UK. So for that reason, for 2 years, I was very focused on rheumatology. I passed my membership exam both in Ireland and UK, and I appeared in 2 interviews. Last interview was unsuccessful, although I was ranked very high, but unfortunately, I couldn't get the seat. But this interview, thankfully, and thanks to God, that I acquired a national training number in rheumatology.
So in terms of your experience of applying for rheumatology and sort of the interview experience, would you like to share some of that?
So basically, I want to tell you, recruitment information, probably in all your interviews, I think our viewers know that how they can apply for specialist training post. There are 2 websites. One is Oriel, where you have to make your account, and the other is the other website, which is HEE official website we called st3recruitment.org.uk. So if somebody wants to apply in rheumatology specialty training, so they should go from A to Z those websites, and I think they can get answer to their all relevant questions. And that, first of all, you have to make your Oriel account, and then there are 2 rounds of recruitment. One is round 1 and other is round 2. Round 1 is good in that way because there are more seats, but on the other side there are more applicants. But in round 2 there is less candidates, but there are less seats as well. But I always recommend that IMGs should focus on round 1 rather than round 2. So interview, Dr. Adnan, interview, basically there are 3 channels. So I wrote something because if I want to give all information, because this is very important. So let me see where I read my. So basically 3 stations. One is the clinical scenario with communication. So I recommend IMGs that for clinical scenario, you should start from the, in the answer, you should start from the history, relevant examinations, tell about all probable investigations, and also talk in your answer about the differentials. So to get higher score, you should talk about differentials as well. Don't forget social aspect in the management. So then after that, don't forget to follow up the patient. So mostly IMDs, when they go to, oh, our clinical scenario went very well, but they miss these things. So I really recommend that when you answer the interviewer in the interview, please focus on these things. The second part of interview is communication skill. So you have to be very simple in the telling to the patient that what is your probable diagnosis and how can you do workup. I think you should be very comprehensive in your answer, because if there is that station, if it's of 10 minutes, so 5 minutes is for the clinical scenario, 5 minutes for the communication. Mostly IMG did do mistake when they answer that, when they know the diagnosis, they become excited, you know, and then they start forgetting the things, and then they don't communicate with the interviewer about the communication skills, and never use medical jargons, never. So it's very easy to pass that station. For rheumatology applicants, I advise that you should study rheumatology Oxford handbook, but if you don't get ample time, so you can just go through Oxford handbook as rheumatology section. That's more than enough. But I think the more knowledge you have, that is better. So the second station is ethical and professionalism. So ethical and professional station is very easy to fail, and it's easy to pass as well. So in which the interviewer is just focused on that, either you know the basic medical ethics or not. I always advise IMGs, think before you speak. So a small slip of your tongue in the answer, and if it go against the medical ethics, you are disqualified. Whatever good CV you have, they don't give attention to anything else if they find that this doctor is unethical. So they don't give you training. And I think we should be very focused on that station. Professionalism, I highly recommend that if you haven't read, you should study GMC principles of good practice, and you should know all 4 domains by heart. Because if they ask you what is the definition of medical professional, probably you don't know, but you should tell them about the 4 domain of good practice. You can download from the website, GMC website, it's available. So if you read that and tell the interviewer, and probably they are seeking that information from you. So I think that station is very easy to fail, and you are straight away disqualified. Like they don't want that the doctor who is in training, he should do something unethical or unprofessional. Now, the third station is, which is quite easy if you already work in rheumatology, is that suitability and evidence folder. First of all, the tip for this station is that when you go to the station, you should understand what interviewer is asking you. For instance, I will tell you one example which I experienced in an interview. The interviewer asked me, where do you stand after 10 years in one interview? And second interview, he asked me where rheumatology is standing after 10 years. So this question, the answer is totally different. So what mostly candidates do, like they don't listen to the interview properly, and then they are, I think, in panic, or they have very like they want to speak more in front of interviewers. No need for that. You are speaking more in front of interviewer. Talk very precise, very accurate, and give the proper answer. What they are asking from you, you should tell those answers rather than talking too much. The other thing which I really want to advise is that don't cheat the interviewers. Whatever you have in portfolio, just put that in file in a proper manner. So you should know whatever you put in your folder. For example, I did my one audit in 5 years ago when I was SHO. I put slides of that audit in my folder, but I'm human, I can forget easily those calculations or numbers. Maybe interviewer just take that audit and start asking questions to you from that. So if you don't know about that thing, I think it's not good sign, and I think interviewer will deduct your marks. So whatever you put in the folder, you should know what you are exactly putting. You should go through your all folder properly before the interview. One day before, that is ideal, but I think if you don't, and before interview, I want to ask you, tell you that you should avoid long journeys. You should have a very good sleep. You should have a proper breakfast, and it's not the end of world if your interview doesn't go well. Still, there is a chance that you can acquire NTN number and you can pass the interview.
And when you mentioned the evidence folder, on the portfolio, especially when you're trying to prove that you like rheumatology and you want to work there. So if a junior IMG is working in medicine now, what kind of things they can do? I mean, one of the things you said, if they're already working in rheumatology, it's easier for them. But maybe they are not working in rheumatology, or what sort of evidence they can gather which will improve their chances through this station?
So for rheumatology, I made I think if you go on ST3 recruitment website, and if you go to Oriel, first of all, you should know the domains which way marks in the initial assessment. If you don't know that thing, you probably not go ahead if you don't know the domains which carry marks in the initial assessment. So that list is available on the website. And I always, like, the problem with the IMGs is, Dr. Nan, that when I come myself, I did one mistake, and that mistake is that, okay, first I will pass MRCP and then think about portfolio. So I passed my MRCP in 2017, and then after passing, I thought, what should I do? Like, where I'm standing, I don't have any portfolio, I don't have any CV. When I start preparing for MRCP for UK, I start making portfolio from the day one. And you should choose the specialty as quick as possible. Don't delay that. if you choose specialty late, it's mean that you are prolonging time to get NTN number. The reason is that because rheumatology is a very competitive specialty. In round one, for instance, 174 candidates were shortlisted for interview, and 73 passed the interview. And on Oriel, there are only 31 seats. So interviewer asked, like they should, so all 73 are the best, and you should be best among the bestest. So the thing is that, so you should always target that if you want to rheumatology as a specialty, you should have a very strong portfolio, and you should try to tick all the boxes of all the domains which we marks in the initial assessment score. For instance, I just want to tell you, first thing is MRSP UK. Many people say that you can apply with before PACES, but I won't recommend that, because if you don't pass your PACES, you will miss 14 marks. So I highly recommend IMGs who are interested in rheumatology pass your full MRCP, so to acquire the maximum marks. The second thing is that undergraduate and postgraduate degree. So you won't weigh marks until you have medical related undergraduate and postgraduate degree. So some IMGs ask me, okay, if I have bachelor or arts, can I claim the number? No, you can't. You should have done something related to med, like you did diploma in sleep medicine, you did diploma in stroke medicine, or if you have done FCPS medicine in Pakistan. So you just claim marks because of that, So the other thing is that if you have some medical distinction, you can claim if you have distinction in one subject and overall, or maybe in any professional exam. So you can claim as accordance. The marks are on the web system. Don't overclaim. I am telling you, don't overclaim. If your whole portfolio is very good, and if you overclaim, the interviewer doesn't get a good impression from you if you overclaim. So they know they are chronic interviewers. So they know that you are trying to cheat them, or you are doing something which is against the medical dignity or being as a doctor. So do whatever, like always put that stuff which you have already done so far. Then clinical audit. So clinical audit is very important. If you are applying in rheumatology as a specialty, I really recommend that you should do audit in rheumatology. So how you will get an idea, that is very simple. If you go through British Society of Rheumatology guidelines, you just see either your department is following that guidelines or not. If not, you can get easy topic. The other thing you can idea is that you can get idea, like if you just go from the previous abstracts, which was presented already by different hospital in their conferences. So just go through those abstracts. Okay, if you don't like these stuff, okay, your co-SPR will help you. Your supervisor will help you. Your clinical nurse specialist will help you. Ask them, sit with them in the tea and coffee, just ask, oh, you want to do audit? Is there anything going on in department? So they will help you. So there is no reason. I always find that there is always someone to help you when you need it and when you want it. So that is, if you do audit, try to choose a very simple topic. The complicated topics, you won't finish your audit in your rotation. So always try a very simple topic. Present in your local meeting. No need to present in international meeting. If you have time, it's good. If you don't have, just do present in your local meeting. And please do re-audit. If you don't do re-audit, you can't claim maximum marks. So what I have done is that I have done 2 journal audits. I have done 4 rheumatology specific audits in my whole 5-year career. So I think after that, I scored maximum in that. Then come on the teaching. There are 2 aspects to score. One is training. So you can just Google it. You can find a very 1-day or 2-course training course. So you should go for it. It's just a 2 marks. You can easily achievable. So I recommend that. For training in the teaching, it's again very easy. So in all departments, mostly undergraduates come. There are F1, F2, and interns. You can teach them. You can just ask your supervising consultant that you want to teach some junior doctors, and you can organize some sessions. For example, one session a week. So don't forget to ask feedback from them. Always print out the feedback forms. It's very easy. You can Google it from RCP UK teaching feedback, so you can get that. Always put that feedback in your file. Whenever you teach anyone, just say, will you please sign this form for me? And that is a very good impression. And you can't attain full marks until you provide feedback in the folder. So feedback is mandatory. Now, presentation. If you don't presentation and the poster, I think the next thing. So I did teaching I have taught rheumatology module in RCSI for 6 months. So after that, I talked with clinical director there. So he was very helping. So he put me on the rota. So, but every candidate has a different scenario, but teaching you can acquire maximum marks. So the next thing is that posters and presentation. So for poster, what you can present in the poster, a good audit, case report, and the third thing is that if there is ongoing research and you have concluded, you can submit abstract. And then once your abstract is accepted in any conference, then you can do poster presentation for that. So in the applicants who are applying in rheumatology, I personally advise that they should submit abstract in British Society of Rheumatology conference, which always hold once a year. That is considered as presentation at the national level, but probably many applicants doesn't know that Republic of Ireland is a different country. So the thing is that ISR, there are 2 meetings happens in a year. So you can submit abstract in Irish Society of Rheumatology rather than British Society of Rheumatology. The reason is that when you present in ISR, you can claim marks as presentation at international level. So I think that is one handy point. The other thing is that you can submit abstract in EULAR, European League of Rheumatism, and then you can, if you feel that your abstract is so good and you want to present in American Society of Rheumatology, you can present there as well. So it's up to you. But please make it sure that if you have submitted abstract for one conference, don't submit that abstract in any other conference. So that's not a good. And if you have claim, for example, if I have done audit and the audit conclusion is very good, and then I want to, then I submitted that audit conclusion as abstract in some conference. So don't claim that marks. So you can't claim, you can only claim that marks either in audit or in poster presentation. So that is very, very handy. So if you haven't done poster, that's fine. That's not the end of the world. If you have done some journal clubs or MDTs, or you have done any case presentations in the intra-departmental meeting, so you should just print out that posters, and then you can submit their slides, photocopies in your folder as well. So at least you can claim some marks for that. Then come on the leadership. Leadership is like, you should not be a world leader. You should not be a national leader. If you don't, you should not a leader of international organism for rheumatology. Definitely at CMT level, or people or applicants who are applying for ST3 post, they can indulge themselves in the ROTA committee, non-consultant welfare committee. So they can indulge themselves there and get a certificate from your manpower or supervisor. You can claim at least 2 marks. I think 2. So, so at least you are that domain is not vacant without any marks. So it's better, you should claim something, you know. So the last thing is publication. If you have done publications, I think that's good. If not, still you can perform if you perform well in interview, you can acquire NTN number. That's it, I think.
That's fine. Thank you very much for your advice and explaining the recruitment process. Are there any general messages for the IMGs? You know, there may be some young IMGs out there who may be thinking of rheumatology or other specialties. Giving your experience of working abroad, away from home, can you tell them any tips or any mistakes, common mistakes they may be making?
I think the common mistake mostly MG made is that they don't take the things parallel. First thing, if they are studying for MRSP, it doesn't mean that you should just forget about your portfolio. You should start working portfolio from day one, you know. If you miss the train, if, for example, many sisters and many friends who can't apply for basic specialist training, it doesn't mean that the training door has closed for them. So they can knock the door at ST3 level. And many of my friends, dozens of people I know, they got training post at ST3 level. So never be disappointed. Start working earlier. Avoid demotivators. So if you work in hospital, always target or always follow the people who are in training rather than always listening advice for someone who discourages you. So that is one thing. So always like focus on specialty. Like for example, I advise MG that if you work in JARI and then next rotation you are trying to get as a registrar post in rheumatology, and then the next year you are trying to get in general GIT. So it's better if you get one specialty, try to excel in and just try to make the portfolio in that, and then probably you can. There is a high chances that you will eventually get training. And last message. So last message is that like if you don't get training number, it's not the end of world. You have a beautiful family, spend some good time with them. Don't be over ambitious, because if you are over ambitious, you will go into the psychiatric problem. Like, you know, I saw many IMGs, like they're depressed. They are feeling always very low, that they are not, it's not the end of world. I have seen people who was not in training, still they are working as a consultant, you know. They just sign their competencies from their rotations and then they submit in GMC and they are on the specialist district. So it's not the end of world. Don't waste your time in overthinking. Don't be over ambitious. I think be focused, be targeted. I think that is the key to success.
Oh, thank you very much for your time and all the good advice. I'm sure a lot of IMGs will find this very useful, and especially in terms of getting training in rheumatology. Thanks again for joining me.
Thank you.